Dr. Amy Killen, so good to see you today. Where does this podcast find you?
I'm in Salt Lake City, which is where I live.
Wonderful, wonderful. There's some beautiful mountains nearby.
And fall is the most amazing time in Utah. So I love it so much.
It is. Is that where you're from?
I'm actually from Texas, but I've been out in Salt Lake for about 12 years now. I left Texas. I was an ER doctor in Texas until about 2013. And then when I left the ER, I decided to go west and kind of haven't looked back.
Why Salt Lake? I'm just curious.
We had some friends here, and I love the proximity to the airport, and you can go anywhere from this international airport. I love the mountains are right there. There's no like driving for 2 hours. I have kids that are now teenagers, and we wanted them to be able to grow up in the mountains, mountain biking and climbing and skiing and all the things like that. So it's just a really easy place to live. So I love living here.
It is. I spend half the year in Park City, just up the hill from you, so I know it well.
So you get it.
I do, absolutely. Let's just bust right into this. I want to talk to you a little bit about the things that we have under our control that we think maybe we don't. I'm going to say there's sort of a spectrum of feeling on this. To simplify it, there's this sort of accept your grim reality or don't.
Yes.
So there's a lot of folks out there who feel quite strongly that things that happen as we age should just be accepted, and that's just the way it is. And there are other folks who think, well, no, we can deal with this in the same way we can treat a cold or anything else.
Yeah.
So give me a sense of like where on this spectrum you sit.
I joke that people talk about aging gracefully and how they're going to age gracefully and just kind of go with the flow. And I'm kind of on the opposite end. I'm sort of a rage against the machine, age ragingly, if that's a thing, and do what you can. Obviously, don't like go crazy, but I think do what you can in terms of lifestyle, and certainly if you have the interest and the means with whatever else you can, hormones or medications or crazy treatment. So I'm on the far other end of yes, let's fight this thing as much as we can.
Okay, so you said don't go crazy. Give me an example of crazy. Is like
Yeah, it's a great
is
question.
Brian Johnson crazy?
I mean, Brian would definitely say he's not crazy and he's very happy. But I think if someone else was trying to do what Brian's doing, it would make them crazy. Like, I think it really depends on what your preferences are, like how much you want to track. Like some people don't wear Oura rings because they don't want to see all those metrics and, how badly they're sleeping. It like stresses them out versus other people, it motivates them. So I think part of it is knowing what motivates you versus what, stresses you out too much.
I have a lot of metrics I keep track of, and I find it really, if nothing else, entertaining.
Yeah.
But I know other people, they're like, oh, geez, I couldn't. How do you deal with that? Yeah. So personality types, I guess.
Yeah, I think that's a big part of it. And are you motivated by fear? Are you motivated by, like inspiration and what you want to do? Like, I think there's so many different ways that we are motivated to be better. Is it because you're scared of turning into your parents, or is it that you're motivated by someone else? Like, there's all these different ways to look at that, but figuring out who you are in terms of this wellness seeker, I think is a big part of then figuring out what's going to work for you and what's not.
So rage against the machine. Love that. So let's go there. What does that look like?
So to me, it's taking advantage of all the things that we have at our disposal in this, in this moment in time. Some people I think get really focused on, only using natural therapies, or only using like, a certain class of, or only using prescription medications, or only using, certain things. I think that the way forward is to take advantage of the best of kind of all the worlds. Yes, use the best of traditional medicine, but also use the best of integrative medicine, or, Eastern medicine, or whatever, wherever you can find the good nuggets, like pull those things from all those different areas and take advantage of it. Don't be so focused on only doing one thing or one style of medicine.
What are the benchmarks you use to see if someone's getting better? Give me a thought on that.
I mean, there's certainly medical tests that we do, as doctors. I like to test labs about every 3 months, if possible. It's a lot of bloodletting, but if you can, just looking at markers of inflammation, looking at lipids, looking at your blood sugar and keeping that low. There are all these different things that we can test in a lab setting. Certainly, you can also look at, metrics at home. You can look at your HRV or your resting heart rate, or, things like that are kind of wellness metrics. And then I think also how you're feeling is obviously really important. Like, how do you feel when you wake up? Like, do you feel like you're ready to go and do great things, or do you feel pretty slow and sluggish and fatigued? So kind of looking at all of those things, subjective as well as objective, and then pulling it together to decide, what's working and what's not working.
Okay. So I come into you, where do you want to see my A1C?
I mean, A1C look closer to 5, like low end. And of course, it's not always, so we know that some people have A1Cs that are a little higher, but they may not even, it just may be not the best marker for some people. But I think in the 5 5.0 to 5.2 is pretty good. Certainly, as you get higher in the fives, you get more, closer to prediabetes and diabetes, and that's not what we want. Keeping your fasting glucose low, keeping your fasting insulin low, your triglycerides, like all of these things, HDL high, which are all kind of tied to insulin sensitivity. Those are all different markers we look at.
I'm sorry to get too into the weeds on this, but so what do you like to see for an LDL?
So I like to look at ApoB.
Or ApoB. What would you like to see?
And I like to see, preferably I'd love it if it was less than 70. If you have high risk and you have a lot of family history, even lower than that. And also looking at the ApoB over ApoA1 ratio, which is a little bit more like, kind of in the weeds, if you will, but something less than about 0.6 is ideal for that, I think.
Okay, wonderful. I keep my labs in my phone. And so
we might have lost some people. Come back,
okay.
come back.
Here. Based on people's answer to that, I sort of have a sense of like where they sit in the spectrum of things.
Yeah.
So talk to me a little bit about like out there, the rage against the machine. Okay. So I know you do a lot of women's health. So a woman walks in and let's just say she's 50. What are the sort of things, and we'll assume that she's experiencing some menopausal symptoms. Oh, well, let's go there. Okay. So at what point do you start thinking about some sort of hormone replacement therapy or something like that?
Yeah. So I'm very much pro hormone replacement therapy, HRT, or it's now called menopause hormone therapy. They keep changing the name, but I still call it HRT. But I think it's great, and as long as it's possible for you. Usually, I like to at least get a relationship with the patient started when they're still in perimenopause. And not all women need hormones during perimenopause, but some do. And some will need some progesterone or maybe some testosterone, or even estrogen towards the end. But not everyone. If you feel great and you're doing well and you just are feeling great, then I think you don't have to take them in perimenopause. But I do like, once you're kind of in menopause, once you're not having periods, I do like to start thinking about we should be replacing estrogen and progesterone, at least maybe testosterone as well.
And why?
Oh, there's so many reasons. The accepted reasons by like the menopause organizations are that estrogen will slow bone loss and prevent osteoporosis and osteoporotic fracture. And that alone is reason enough for me. That's something 1 in 2 women will get osteoporotic fractures. And that's a lot of people. And these things, when you get a hip fracture, you have a 25% 1-year mortality rate. So this is not a benign, this is not like when you're a kid and you break your arm skateboarding and you get up and you're fine. These fractures debilitate and kill people, men and women. And so I think there's a lot of debate in the hormone replacement world about whether these hormones prevent heart disease or whether they prevent dementia or whether they prevent, X, Y, and Z. And I would say that they probably do, but what we know is that they prevent bone loss, and there's nothing better than estrogen for preventing bone loss. So I think at the very least, consider taking estrogen to protect your bones so you don't fall and break a hip and then, end up walking with a cane or not walking at all, or unfortunately, dying.
Right. Okay. Asking for a friend, 65-year-old guy walks into your clinic. What should my friend do?
Well, we like to get labs. We do a lot of, I have a couple of different clinics. I have one here in Utah and I have another one in Austin. And depending on where you come, we always do labs. And then in some clinics, we'll do more, full body assessments, DEXA scans and VO2 max tests and that kind of stuff too. But we'll get all the information together and then look and see what the problem areas are. Men are a little different than women in that not all men need testosterone. So when women go through menopause, you essentially hormones, estrogen, progesterone, like fall off a cliff and you don't have any. And there's nothing that you can do in your lifestyle to bring those hormones back because you're out of eggs, which is what, essentially what's making hormones. With men, it's a little different. So with men, testosterone tends to kind of go down gradually as you get older, but you can influence it in a lot of ways by staying healthy, by lifting heavy weights, by getting a little sun, by getting the proper nutrients, by sleeping well, keeping stress down, all of that. So with the men, it really is oftentimes lifestyle dependent, not always, but sometimes if you're leading a healthy lifestyle, testosterone stays pretty high. Eventually it will go down. Eventually you'll lose the ability to make testosterone, but with men it's a little different than women. So I get testosterone levels. I get free in total. I get all the other hormones, thyroid, all your blood counts, all those things. And then we decide, what do we need to do about what's going on with your labs?
And so I've often heard with women I'm just going to say HRT because that's
that's what I say.
So it's oftentimes symptom driven rather than level driven.
Yeah.
Is men the same, symptom driven versus level driven?
So yes and no. I think First of all, with women, I would argue that you should also check levels. And this
Okay.
this is not how a lot of doctors do it. But I do think in menopause, once the levels are stable, then getting an estradiol and a progesterone and testosterone level. And I have actual numbers that I want to see those levels at,
Mm,
because we know that at those numbers is when you have bone protection, heart protection,
mm.
different areas of protection. So I check levels. I check levels in men too. In men, I like to see testosterone. Usually I measure free testosterone. I look at that more than total, which is the unbound, active form of testosterone. I like that to be in the upper end of the reference range. And every lab has a different reference range. So, but like kind of the middle towards the top of that reference range is generally where I want to see that.
Okay. So now I want to ask you about this fascinating thing that you mentioned before we get on the call called reputable health and these studies about supplements. Because as we know, doing like full on double blind studies of, thousands of people, they're insanely expensive.
Yes.
So what is it that you're doing here?
So it's reputable.health. And this is a website this is a company that I helped develop that has just now gotten legs, and it's really going kind of crazy. But basically the idea was there's all these things in the wellness space that are kind of unvetted. Like, people say they think they like them or they don't like them, but we don't have a lot of solid evidence that they actually work. And so the idea was, how can we use real world data that people are already collecting with all of their wearables and use that to help decide if things are working or not. And so as a consumer, you can go onto the site and you can sign up to be a study applicant, a participant, where you're getting involved in studies. You can get free stuff sent to you, like supplements or devices or whatever it is that needs to be studied, as long as you have some kind of wearable to check it. And essentially your data gets sent to Reputable, and it just looks at trends as you're taking these supplements or doing the wellness things. And then the companies on the other side, wellness companies, can put together actual clinical studies and trials. We have a person that helps to do that in the right way, that are powered properly to be able to actually vet their supplements or devices or whatever it is. So it's kind of like you can participate from either side, but it's a way to try to help to bring some objective data to the wellness world.
Like somebody like me. So I sleep with a Whoop. So I would sign up and say, okay, I'm willing to test something. So you would take the data from me and my fellow Whoop wearers, and then the people who produce the supplement could use this data to then design a study. Is
So
that how
yeah,
that
so
goes?
you could sign up and say, "Hey, I have a Whoop," and Whoop is one of our devices that we use. So you can say, "I have a Whoop. I'm game to to do a study." And then when something comes up that's appropriate, they will pull you into it, and you say yes or no to essentially share your de-identified data. And it's obviously
Mhm.
doesn't have your name or any of that stuff in it, but share your data to the app as you're doing the protocol. So maybe they collect your data for 2 weeks before you start to doing anything. And then maybe you start a supplement, and then you take it for X number of weeks, and it's just following your data during that time. And so it's following your Whoop data. And usually the supplement company will have certain metrics they're looking for, like they think it's going to improve sleep, or it's going to improve
Mhm.
HRV or whatever. And we can also build in labs and other things to it, but the simplest version is essentially you're not doing anything except you're adding in the extra thing, supplement, you're doing that, and then your data gets sent to Reputable and the company to look at to see, is this actually helping? Is it not? How much? And you get actually, very specific information, like this improved your HRV this amount, this decreased deep sleep this amount, like very specific metrics for you as the consumer, just to see if it's helping you. And on the other side, those are also sent to the company that's doing the study.
Super hard to do controls on that, though. I'm thinking,
Yeah, for
it's
sure. It's not a blinded control, for sure. You're not doing any, obviously you are taking the thing, so it's not
right.
blinded. You can do crossover type studies though, where you're taking it for a period of time and then you're not, and then you are, or things like that, where you're on and off doing different things. So certainly it's not as good as a placebo-controlled randomized study, right? Like it's not the gold standard. However, it is great for getting information, and maybe that company decides, hey, we're seeing a lot of
Mm,
people have improvements in sleep. Now we want to put the money forth to do, a
mm,
more formal randomized controlled trial, around sleep or whatever. So it's kind of like a nice way to start that conversation of
right.
where, what do we see that we think is helping, so that you can design a better study down the line.
I've been wearing a Whoop for 4 or 5 years. So like it'll average the data over months or years. And so, I'm thinking like day to day, things move around quite a bit.
Sure.
But if you're doing a study over a period of 6 months and there's a 10% change either way versus the past 5 years, that would be
Yeah.
significant. You could see that. Yeah.
Yeah, exactly. And this also allows, it could also be use other kinds of data. Like for instance, maybe you want to have everyone get a blood test and have their blood sugar and
Hmm.
their, CRP, their inflammatory markers checked ahead of time. Then you do
Right.
a protocol for 3 months or 6 months or a year or whatever it is, and you recheck those indices along the way. And so that's pretty objective data.
Hmm.
Certainly your diet could be changing, your stress could be changing. Like
Right.
we can't control everything, but it's also a nice way to look at like, well, how is this report performing in the real world where we don't have control over everything? So it's kind of one
Right.
of those things like I kind of want to know if the supplement works in the real world with real people versus like in a laboratory setting where we're controlling every single thing about their lives.
Right, 100%. Are you allowed to tell us anything that's been surprising on the positive or negative from Reputable that you've discovered?
Yeah, I mean, I will tell you. So my company, which is called HOP, it's a supplement company for women's longevity. We have like longevity pack and a stack kind of thing for women. And we did a small study with Reputable just in the very beginning. We were kind of learning how this whole thing worked. And what we learned is that when people took our packs at nighttime, which was we were telling them twice a day. And we were telling, and the people who took them at nighttime were actually having worse sleep than if they took them earlier in the day or didn't take
Hmm.
that second dose. And so we learned that a lot of people were very sensitive to some of the ingredients and it was keeping them up. And so it
Hmm.
actually ended up changing on our side how we told people to take these ingredients. And once they changed how they were doing it and just took them earlier in the day, then we saw improvements in sleep, which is what we were hoping to see. It was kind of a negative outcome, but it led to us, making changes for the better, I think.
That's super interesting. I find that a lot of these studies, the really like highly powered clinical ones, the difficulty is there's a distribution of data, right? There's always some outliers on the curve. So I find that there's some people that have the temptation to be like highly prescriptive about these sort of things, but
Yeah.
it really comes down to like what's your own biology and how do you react to these things
Yeah.
and looking at that.
Well, absolutely. And what this platform will do, hopefully, it's going to grow, but and platforms like it, there's many things out there, but they're using AI and sort of big data analytics and things like that, is that we're going to start to be able to say, hey, I'm a 48-year-old female who is, Caucasian and don't have a lot of muscles and I'm thin. And how would this supplement work for me? Because when you have, if you have big enough data sets, we
Right.
have people, people are doing all of their own sort of non-study studies on themselves every day. Like you're taking supplements, you're doing things, but you're just not necessarily tracking it in any kind of way. So if we can get to some of that sort of real world data, we can start to
Hmm.
actually very specifically say, this would work, this would probably work for you as this person who's this age, who has this history, et cetera. So that's the goal ultimately, is to be able to say, what is going to work for me?
Right.
And then of course I try it and see if it's going to work, but that's what we're hoping to do.
So where I can see this going is highly granular phenotypes.
Yes.
So rather than just I'm a male, I'm a female, this age, but rather a huge spectrum of phenotypes here where you identify yourself as one of these phenotypes and that can drill in on what there's a high probability that will work for you.
Yeah, that's the goal. I mean, that's the goal with our platform, but also many others in the space is really being able to drill it down and make it personalized medicine based on, all the things, genetics and
Yeah.
epigenetics, and, diet and family and all the things.
A couple of years ago, I would have said this is just too hard. I'm not saying it's not hard, but I think that that's coming faster than people think.
I think it is too. I think that it is hard. And this company, we started about 4 years ago thinking about how do we do this? And it was at the time, it seemed like kind of undoable. Like this doesn't seem possible. But just in the last couple of years, and even the last 2 years, with what we're able to do, with basic, AI and LLMs and things, I do think it's possible. And I think that there's so much uncollected data out there, in terms of wellness information, health information, that, obviously we have a hard time in medicine because all of the health data is siloed. It's all in
Yeah.
this hospital system or this one, and none of it talks. And that's all, the medical records, the EHRs don't talk. They are not compatible with doing any kind of like evaluations of data. So it's very difficult. But I think when it comes to like wellness stuff, this is an opportunity to use what, people are already doing their experiments, but then how do we learn from them?
In my perfect world, there's genetics, there's your blood work. There would be some sort of a advanced version of a CGM, continuous glucose monitor, something that measures things like minute to minute or every 5 minutes, your all kinds of stuff in your bloodstream, but also your functional outputs. Okay, like today, how long can you hang on the bar?
Yeah.
Less or more than yesterday. And you bring all this information together because every day is not the same, right?
Right.
I really think there will come this is David future casting. I really think there's going to come a day where I get a text that says, okay, today, eat this, do this, go to bed at this time. This is best for you. And I can choose to ignore that or do it. But I think that that's not like impossible.
It's not. I think it's getting closer. I mean, even we already have like, I don't have it on, but I have an ultra human ring, which is like, it's kind of like an Aura ring, but it's a different ring. But they have the ring and they have a CGM and they have a home device that sits in your room and like collects like noise information and light information and things like
Oh
that.
my God.
And all
Awesome.
of this go, the CGM, the ring, the home device all goes into one dashboard. And
Yeah.
so, and their vision, and I don't work for them, by the way, but their vision is to have, being able to put just more and more of this
Right.
data collection into one dashboard or one thing that can really help be like, hey, you should not have caffeine, after this time, and because whatever. The hard thing, I think, as you probably understand, is that a lot of us are doing so many things. How do you know what's actually helping or not helping?
Absolutely.
Like, how do I know
Yeah.
that my cold plunge is doing anything for me, or that my PEMF mat or my red light therapy or a certain diet, like, because there's so many things, you don't know which is helping and which is not helping. You just kind of throw spaghetti at the wall and hope that some of it sticks.
And they interact,
Yeah.
right?
Yeah.
Like all these things interact. And I feel like oftentimes I'm just some sort of like science experiment on myself, but I'm not really collecting data. I'm just
Yes.
ingesting, right?
Right. Right. Well, I guess that this is where someone like Brian Johnson, at least he's tracking everything. Like, he's doing a lot of stuff, but at least he's like methodically tracking it. So hopefully there's some information to be learned.
We've had Brian on the show, and I'm a big fan of Brian's. I think he's a lovely human,
Yes.
unusual guy, but I really like his like don't die thing. I think that that's great. I
Yeah.
think what people need to understand. Now, I tried Brian's protocol. So
Did you?
this was like 3 years ago when he just put out Blueprint. I tried this, the vegan diet and the supplements and do these things.
Mhm.
I did that for a month, and my wife came home from a trip and she said, "What's wrong with you?" I got dumb, I got fat, so it just like destroyed me.
Really?
Yeah. So I want to say that Brian's thing works really great for Brian.
Right.
And he spends a lot of money sort of dialing all this in. But just because it works for Brian, it
Yeah.
may or may not work for you.
No, absolutely. And they're collecting all the information about, the rapid aging and how slow people are aging. And there are people who are not doing, they're not doing any of that stuff. There's a woman and a guy who, they just eat healthy, they exercise,
Yeah.
and they're aging. If you look at the True Diagnostics clocks,
Yeah. Yeah.
aging at as slow a pace or slower pace than Brian. So I definitely think that it's very, very, very variable.
Yeah. It's funny. I like those true diagnostic tests.
Yeah.
Ryan Smith.
Yes.
Uh,
Oh yeah. Ryan's
um,
super smart.
yeah, he's super smart. I love him. We've had him on here a couple of times. That's like one of those metrics. I don't quite know exactly how useful it is, but it's sort of like you can see the direction of the ship.
Yeah. Yeah. It
Are
can
you
be
sort of
really motivating too. Like, if you see that your rate of aging is, faster than one, if it's over one year per year, then it can be like, oh my gosh, I got to do something about this. So that test doesn't necessarily tell you why your aging
right?
is not as good, but it does put you in the mindset of, okay, I got to do better.
Yeah, and I think that the last time I talked to Ryan, I think they're getting sort of organ specific on these
They
things.
are. They are. They have a new test. It's like a multi-omic test.
Yeah.
Yeah, it's an omics test, I think is what it is, where it's supposed to be able to give you information, like essentially estimate what your hemoglobin A1C is without without actually directly checking it, just on epigenetics. So just on the changes around the DNA, estimating various organ functions. So I know that some doctors are using it in the space. I haven't used it much myself, but I would like to experiment with it. I think it's really cool.
It sort of I mean, I like them, but it sort of falls into the realm of like wellertainment for me. You know?
Yeah.
Like,
Yeah.
it's like,
Yeah.
oh, this is really amusing.
That's so funny. I was putting together a talk for a conference I'm speaking at pretty soon, and I'm talking about like myths and kind of myths, misconceptions, missteps that we've made in women's health. And one of the things I was thinking about is just in health in general, and I think especially in this kind of functional health wellness world, this idea that if a test is available, you should do it, and that it's going to be useful, because we think that more information is always better, but it's not always better. Like, sometimes it just distracts you. And
Hmm.
sometimes it's not even, it's going the wrong direction. And so I think, figuring out the tests that are useful and not distracting is actually really important as doctors and as people are taking a test.
Exactly. Like I would never show my doc my true diagnostics test. She would just be like, why are you showing me this?
Right.
What am I supposed to do with this?
Exactly.
Tell me, I want to wrap up in a second, but I want to ask you, since we're in the realm of testing, so there's what is it called? The Galleria test, right? The bloodborne cancer
Cancer
test.
screening.
So
Yeah.
there was like a big sort of thing with the UK National Health Service, and they were like, no, we can't use this because it's just really only detecting like 20%, I think, or something. But they hadn't really fully completed their study. It's supposed to be a 3-year thing, and I think they just ran it for a year and decided to kill it. What are your thoughts on the bloodborne cancer test?
I'm not a fan really of the tests that are available currently. I think that the Galleri test has a lot of, it just doesn't have the specificity and the accuracy that we need to be able to say you do have cancer or you don't have cancer. Like it's a big statement to make. Either one of those things are big statements. And I think that we're just not there yet. There's a lot of companies researching this space, different ways to look at, different parts of cancer and different parts of DNA transcription and things like that. And I'm hopeful that some company in the next couple of years has a better test. But right now, I'm not currently using. I have done the Galleri test, but I'm not currently using it with patients.
And the other one people talk a lot about, full body MRIs.
Yes, yes. That's what I think I think that they can be valuable, although I've talked to a couple of radiologists about this, and they recommend, instead of doing like the Prenuvo, like a full body head to toe MRI, doing like a brain MRI and MRA. MRA gives you the blood vessels. Do a chest MRI, do an abdomen, do a pelvis. But if you do them separately, then you don't have as much radiation exposure. So you're not doing the limbs, like you're not doing the legs, and you're not, the arms and things like that. And there's going to be a lower chance of a false positive if you are, doing it that way. With the chest, they recommend actually not doing MRI. They recommend doing a CT scan. So the head MRI, MRA, belly and pelvis MRI, and then a CT scan of the chest, because that's the best way to find like a lung cancer or something. So that's what I'm going to be starting to do with patients. Instead of doing just whole body MRI, be a little more specific, but still hopefully catch anything, kind of crazy. But there's always a risk of false positives, of course.
By far not an expert on radiology, but my understanding is it has a lot to do with the machine, the algorithm, and the person reading it.
Yes. Yeah. Those all make a difference. And the protocol too, this is why the radiologist I spoke to said, if you get a dedicated, like for instance, abdomen MRI, it's going to be, usually you're going to get better images and you're going to have a less likely chance of having, like random scatter or things that picking up things that aren't real, like incidentalomas, we call them, things that are just incidentals that you don't want to actually work up. So I do think that there's a place for them. I think you have to always, I always tell patients, if you're interested in a full body MRI, that's great, but you have to know that there's a decent chance that we're going to find something that's going to have to get worked up. So like, I had one done and they found something on my ovary and they're like, yeah, it could be a cyst or it could be a cancer. And I was like, oh, cool. And so then I had to go find a PCP because I didn't have one. I had to get a doctor. I had to get that doctor to write an ultrasound and I had to go get 2 of those over 6 months. It was like all these things and it was totally fine. It was benign. It was a cyst, but it was a lot of extra work on my part after the fact to chase down the benign finding from the MRI. So as long as people know that going in, then I think it's okay.
Right. Or you go into biopsies or something, like the next stage of test, there's risk associated with that.
There can be, yeah.
Yeah.
And, I think it's also important to know that like sometimes, you may get an MRI done as like, just as with some random doctor or by yourself, and then you have all these results and you have to go find the doctors. Like a lot of us don't have, we don't have a gastroenterologist. So how do I get that person? And, you got to go find the doctors that can do the next things. And so it's more than just like, oh yeah, you may have to do some more tests. There's a whole lot of extra steps involved if something positive is found.
Yeah. I haven't done one.
Yeah.
And I'm not.
But also, if I had an ovary cancer and, and they found it before it was symptomatic and it could have been treated and cured. So I can see both sides of it.
Yeah, you're right. I share your confliction on this. I've talked to my provider about the Galleria test. I did it. The specificity issues. My feeling is, well, if it's right 20% of the time, that's more than what I have now. So, okay.
Yeah. I mean, it's $1,000 test, so it's a little expensive, but one test that I really do like, and I think that probably all men over 40 and all women over 50 should do is the CCTA. like the Clearly scan, the CCTA. It's
Oh, for the
a
heart.
chest CT angio to look at the plaque in your arteries. There are a lot of people, even people who have normal calcium scores, for instance,
Mm,
about 15% now we're finding actually have soft plaque in their arteries if you
mm,
do like a CCTA with AI or the Clearly scan. And that's beneficial because if it's soft plaque, we can reverse it. Like if we know
right.
about it before it breaks off and causes a heart attack or a stroke, we can reverse it with lifestyle and supplements and medications and things like that. So I think that's actually really valuable to have. Get a baseline. It's not expensive. It's not a lot of radiation. And if your arteries are clean, great. You're good for a few more years. And if they're not, then, repeat it again in a year and work really hard to get that plaque out of there.
Well said. Amy, is there anything you want to leave the audience with today?
I really believe in like the empowered patient. And one of the things I talk about with all of my different projects, and one of the overreaching kind of parts of all of them are that we all have so much power to change how we age, how healthy we feel, how we go through the rest of our lives. And whether you do crazy tests or whether you just keep it simple and do the basics and exercise and sleep and keep your stress down and eat well, like that's great, but take ownership of how you age because no one else is going to do it for you.
That's right. Something we talk about here a lot. There's sort of the 5 things. You need to go to sleep. If you're not sleeping, nothing else is going to work. I'm sorry.
Yes.
You need to exercise. What are you putting in your mouth? Make sure it's the right thing. How are you dealing with your stress? And what is your sense of connection to others, to yourself, and to something greater than you? Get all that stuff lined up, and then we can talk about the exotics. But
Yes, absolutely.
none of the rest of this is going to do anything unless you're doing that stuff. So
That is absolutely
yeah.
true.
Okay, wonderful. We will put your contact information in the show notes. Thank you so much for coming on today. I am going to research a CCTA scan. I'm not familiar with that. So
Perfect.
thank you for letting me know what that is.
All right. Thank you.
Okay, take care, Amy. Bye now.
Bye-bye.